Hello, this is Dr. Grande. Today's question is, can I analyze the testimony of Dr. David Spiegel on day 20 of the Johnny Depp Amber Heard defamation trial? Just a reminder, I'm not diagnosing anybody in this video, only speculating about what could be happening in a situation like this. If you enjoy this video, please like it, subscribe to my channel, and consider supporting me on Patreon. I will put the link to Patreon in the description for this video. First, I'll look at a brief background of the case, move to the summary of the testimony, then offer my analysis. In December of 2018, the Washington Post published an op-ed written by the actress Amber Heard, in which she implied that she was a victim at the hands of her ex-husband Johnny Depp. She didn't specifically name him. Johnny Depp filed a lawsuit against Amber Heard for defamation, and she countersued. In April of 2022, the trial started in the Fairfax County Courthouse in Virginia. Now moving to the summary of the testimony, I will be covering Dr. Spiegel's testimony from day 20, which includes direct examination, cross-examination, and redirect. I have changed the order of some of the items and paraphrased in this summary. Dr. Spiegel's testimony starts under direct, so Amber Heard's attorney is asking him the questions. Dr. Spiegel has been a psychiatrist since 1993. He is familiar with substance use and intimate partner violence, which I will refer to as IPV. He was briefly challenged by Johnny Depp's attorney about his knowledge on IPV. Then Amber's attorney continued with questioning. Dr. Spiegel indicated that he reviewed a lot of information for his testimony, including records from Dr. Curry and Dr. Hughes, both of whom testified during this trial. He said that Johnny Depp refused to submit to a direct clinical assessment on 2 occasions, so none of Dr. Spiegel's testimony was based on having direct contact with Johnny. Dr. Spiegel indicated that he would be testifying about IPV risk factors, substance use, and the psychological profile of a perpetrator. He indicated that Johnny Depp's behavior was consistent with somebody who has substance use disorder and who perpetrates IPV. Then we see this discussion about the mini mental status exam. This is a 30-point instrument primarily used to assess people suspected of having significant cognitive problems. Technically, anybody can be administered the exam. Dr. Spiegel specifically talked about one section of the exam where the client is told to remember 3 words and then repeat them back a few moments later. When Johnny Depp took that test, he was unable to recall any of the words. The clinician also believed that Johnny Depp was fed lines through an earpiece when filming movies. He apparently read this from some source. Dr. Spiegel felt as though Johnny Depp's processing speed had decreased over the years, his attention span was impaired, his narrative was disjointed. His cognitive limitations were inconsistent with somebody Johnny's age. A person in their 50s would expect to have some cognitive slowdown, but nowhere near the amount Johnny appears to have. The clinician implied that Johnny's cognitive performance was somewhat better during the trial. Dr. Spiegel then reviewed the risk factors for IPV. These include when a person is jealous, has mood swings, is impulsive, or has ideations of violence. He noted that everybody has violent thoughts, but they have the ability to control themselves. Substance use impairs this self-control. Dr. Spiegel talked about how Johnny was using both Seroquel and gabapentin. Seroquel is sometimes used off-label for sleep, and gabapentin can be used to calm people down. The clinician made it seem as though Johnny was pharmacologically assisted in both waking up and going to sleep. His natural circadian rhythm was not what dictated his sleeping schedule. Rather, drugs were used kind of like an on-off switch. These drugs, combined with other drugs Johnny was using, could have made him psychotic, jealous, and suspicious. According to the clinician, Johnny's behavior was consistent with many risk factors for perpetrating IPV. For example, his use of alcohol and drugs, his attempt to limit Amber's career development, breaking things, writing in blood, and making threats. We then see this whole discussion about narcissistic personality traits and narcissistic personality disorder. Dr. Spiegel provided examples of Johnny's behavior which were consistent with having narcissistic personality traits, like his belief that Amber married him for his fame and power, his repeated apologies, like when he referred to the monster, his jealousy, and the trial itself, which Johnny may have pursued for revenge because his ego was damaged by Amber. Dr. Spiegel was asked if he knew what gaslighting was. He said that he did, but then he described gaslighting as the difference between an upset victim and a calm perpetrator. It seems clear he really didn't understand what gaslighting was. Amber's attorney then directed him to a topic where he could actually talk about gaslighting by asking him if a perpetrator ever claims that a victim is actually the perpetrator. Dr. Spiegel confirmed that this happens. The discussion then moves to the Goldwater Rule. This is an ethical rule in Section 7.3 of a document produced by the American Psychiatric Association titled The Principles of Medical Ethics. Only members of the APA are limited by this particular rule. Therefore, it is applicable to a very small percentage of mental health professionals. The rule states that it is unethical for a psychiatrist to offer a professional opinion unless he or she has conducted an examination and has been granted proper authorization for such a statement. Dr. Spiegel argued that the rule doesn't really apply to him because he is functioning as an expert witness. He's not looking at the case from the point of view of the general public. He's not watching it on TV or looking at a movie. Rather, he has reviewed a lot of confidential information. He also mentioned that he twice offered to interview Johnny Depp. Now moving to the cross-examination, this is where Johnny Depp's attorney is asking the questions. Here we see a heated argument about the Goldwater Rule that goes back and forth for quite some time. Johnny's attorney is essentially suggesting that Dr. Spiegel is not acting ethically. The clinician argued that to follow the rule would eliminate expert witnesses off the face of the planet. He then argued that he's really not making a diagnosis. For example, IPV, narcissistic personality, and substance use are not diagnoses. Johnny Depp's attorney points out that the Goldwater Rule applies to professional opinions as well. The discussion continues, and Dr. Spiegel concedes that he is more or less diagnosing Johnny with substance use disorder. The attorney argued about the 5 of 9 criteria required to diagnose narcissistic personality disorder, NPD. He suggested that Dr. Spiegel didn't demonstrate how those criteria were met. The clinician talked about how cluster B personality traits are risk factors for IPV, and narcissistic traits are a subset of cluster B traits. Cluster B personality traits include narcissistic traits as well as those from antisocial, borderline, and histrionic. Dr. Spiegel acknowledged that borderline and histrionic personality disorders are also risk factors for IPV. This is significant because Johnny Depp's expert diagnosed Amber with these 2 disorders. The clinician admitted that somebody can have narcissistic personality traits and substance use disorder and not perpetrate IPV. So the clinician can talk about general risk factors for IPV, but that doesn't necessarily mean that Johnny Depp is a perpetrator of IPV. There was a discussion about the mini mental status exam, during which Dr. Spiegel acknowledged that if a client was high on drugs, they might not be able to remember the 3 words that Johnny could not recall. Cross-examination ends with a discussion about the prevalence of earpieces for actors, like Johnny wasn't the only one who uses them. Dr. Spiegel said that he knew nothing about acting. This seems reasonable. Considering he's sort of on Amber Heard's side, it's nice to have something in common with her. Now moving to redirect, Dr. Spiegel suggests that he had access to private records, therefore he did not violate the Goldwater Rule. This is not a good defense against an accusation of violating the rule. It mandates that a clinician directly examine a client. I'm not aware of any distinction made between public and private information in the rule. Dr. Spiegel answered questions from Amber Heard's attorney, again this is redirect, about how Johnny Depp's behavior aligned with narcissistic personality disorder, including Johnny's need for admiration, sense of entitlement, tendency to exploit people, lack of empathy, and his tendency to be envious. Redirect ended with the clinician indicating that he disagrees with Dr. Curry about Amber having BPD and HPD. He said that she did not meet enough of the criteria for those diagnoses. He also suggested that battered woman syndrome can be confused with borderline personality disorder. Maybe that's what happened in this case. Now moving to my analysis. Here are my thoughts about a few items that stood out to me in this case. Item number 1, Dr. Spiegel correctly described narcissistic personality traits as different than narcissistic personality disorder. Personality theory explains how people tend to behave. Disorders are labels that help guide treatment. A person can have traits of narcissism and not have the official mental disorder. What's more, the diagnostic criteria for personality disorders are not as valid as the criteria for many other types of disorders. I am skeptical of personality disorder definitions and diagnoses. There has been a lot of debate for some time about moving away from categorical personality disorders to a dimensional model, like thinking about traits on a continuum as opposed to distinct categories. The categories are crude, but easy to use. The dimensional model is more accurate, but many clinicians don't want to make the commitment to learn how to apply it. Item number 2 is the mini mental status exam. This exam is often used in populations where there is a high risk for cognitive dysfunction. There are many versions of this instrument, but they are all fairly similar. Dr. Spiegel was talking about 3 words that have to be memorized. He didn't name them specifically, but in most versions of the test, the words are apple, table, and penny. He suggested the client is supposed to remember those words and repeat them back about 5 minutes later. I disagree with the 5-minute part. Typically, the words are repeated back after just one other exercise, specifically serial sevens or spelling the word world backwards. So with serial sevens, the person counts down from 100 in increments of 7. So 100, 93, 86, 79, 72, 65, and so on. For spelling the word world backwards, they simply spell the word backwards. So DLROW. Given that only one of these exercises is before the recall exercise, we would expect the client to repeat the words back maybe 30 to 60 seconds after hearing them and repeating them back initially, not 5 minutes later. It simply doesn't take too long to count down from 100 in increments of 7 or spell the word world backwards. Either way, Dr. Spiegel is correct when he says that not remembering any of the 3 words is a bad sign. Usually a client will remember at least 1 or 2. These words are not covertly inserted into the test. The client is told that they need to remember them and they will be asked to repeat them in a moment. So one possibility here is that Johnny wasn't really paying attention, like he didn't really care, so he didn't bother memorizing the words in the first place. The mini mental status exam does not have a lot of room for error before someone's score becomes consistent with suboptimal functioning. A person with some high school needs at least 24 out of 30 points to be in the normal range. A high school graduate needs 25, and a person with some college needs to score 26 or greater. It is my understanding that Johnny Depp did not graduate from high school, therefore 24 points or greater would be normal. Item number 3 is the Goldwater rule. As I mentioned, the rule only applies to psychiatrists who are members of the APA. The reasoning behind the rule is hotly debated. Many clinicians believe that it may have made a little bit of sense in the 70s, but it is simply not applicable to the modern world. I think the whole issue with Donald Trump potentially being narcissistic really challenged the faith that clinicians had in this particular ethical rule. They became worried that they were not able to speak out using their expertise about someone who was in a position of tremendous power. Many clinicians violated the Goldwater rule in reference to Donald Trump, and nothing adverse happened to them. I view the Goldwater rule right now kind of like the idea of marijuana being illegal. Yes, in many areas it is still illegal, but no one cares. I'm compelled to agree that the Goldwater rule is antiquated and more leeway should be permitted, but I still don't think mental health clinicians of any type should officially diagnose people they have not met. It's one thing to talk about what could be happening or what symptoms may be present. Of course, an educational discussion should always be encouraged and permitted. However, it's something completely different to definitively pronounce with confidence that a particular living person has a specific disorder. The main reason this is a problem is because there is no way to know for certain if they have it or not. Considering that in-person assessments are often not valid, ones made without the person present have little chance. So now moving back to Dr. Spiegel's testimony, I feel like all he was really doing was pointing out what everybody already knew. There was no evidence that he had learned anything shocking or dramatic from these top-secret records that he had access to. In addition, many of those records have been discussed during the trial over the last few weeks. I agree that the Goldwater rule cannot always be followed by clinicians, including expert witnesses, but I don't see how Dr. Spiegel could be so sure about his conclusions. The part I think that I worry about here is, how does he really know with certainty what's happening with Johnny Depp? Do I think of Johnny Depp as any more narcissistic, substance-using, or violent based on Dr. Spiegel's testimony? Not really. The clinician pointed out the obvious. Without an in-person examination of Johnny Depp, his testimony just wasn't that helpful. As I mentioned in other videos, I believe that Amber can legitimately claim that she is the victim of IPV. I think that Johnny can make the same claim. The question is not really about defamation anymore. Rather, it's about how much destructive behavior was exhibited by each of these people. They're trying to fight for the hearts and the minds of the public. Now moving to the final item, number 4. This is Dr. Spiegel's attitude during cross-examination. It's one thing for Dr. Spiegel to push back against Johnny Depp's attorney, but it's another thing to be rude, condescending, and talk about things not related to the question. He spent a lot of time defending himself on the Goldwater rule issue when he should have just said that he was choosing to break the rule because the rule doesn't make any sense. He argued about the significance of forgetting those 3 words on a mini mental status exam. He should have just admitted that intoxication could have affected the results. Dr. Spiegel attracted more attention to the arguments that Johnny Depp's attorney was making. I think that Dr. Spiegel just made the whole situation more difficult than it needed to be, and gave the jurors a reason to discredit him if they were already leaning in favor of Johnny Depp. If they were looking for a reason not to like him, he supplied it to them. Those are my thoughts on Dr. Spiegel's testimony in the Johnny Depp-Amber Heard trial. Please put any opinions and thoughts in the comment section. They always generate an interesting dialogue. As always, I hope you found my analysis of this topic to be informative. Thanks for watching.